Hello everyone, my name is Gracie Rodriguez. I have my biology class 1409 at South Texas College, and my professor is Professor Canto. Today my topic is cancer, and I will explain it right now. First of all, what is cancer? Cancer is a uncontrolled growth of abnormal cells in the body. It develops when the body's normal control of mechanism stops working. It's also when cells don't die and they grow out of control, they form a tumor with the extra mass of tissues. In cancer, there is many types of cancer that are involved. For example, breast cancer, prostate cancer, basal cell cancer, melanoma, colon cancer, lung cancer, leukemia, and also lymphoma. How do people get cancer? Well, there are many ways people can get cancer, but first of all, cancer is not contagious. The environmental exposure can be a major factor for people getting cancer. Bacteria and viruses can also cause cancer. Radiation or some drugs increase the risk of cancer. Also, it is known that it can be inherited, or it can be passed on by genetics, or it can just really be a random chance at people getting cancer. It also increases by the age and how people live their life. There are symptoms that come with cancer. For example, blood in the urine, hoarseness, obvious change in wart or mole, unexpected weight loss, night sweats, and even fever. Itching in the anal or genital area, vaginal bleeding or discharge, unexplained anemia, low blood count, and also changing urination. Also, unusual diarrhea, fever, fatigue, pain, skin changes, lumps, or even persistent cough can be some of the major symptoms that can come with any type of cancer. It is greatly advised to see a doctor right away or to see a doctor and get some tests done so they can know what kind of cancer can come with the symptoms that you have. How can they detect cancer? Clinical examination, imaging, computer tomography, magnetic resonance imaging, positron emission tomography or PET, mammography, and isotopic diagnostics. In clinical examinations, it is based on your family background and charts. In imaging, it involves radiological imaging to check the spread of cancer, progress treatment, or monitor even cancer. In computer tomography or CT, it's a cross-section imaging using X-rays. Magnetic resonance MRI imaging uses powerful magnetic fields. It examines cancer or sarcoma in the head or neck region. In the positron emission tomography or PET, the patient is given a radioactive tracer. Mammography, it's an X-ray image that is used to examine breast tumors. This is also used in breast cancer screening. And last, isotopic diagnostics, a radioactive tracer in the patient's body. The marker goes through the organ to be examined. Okay, so now it's breast cancer. Breast cancer is mostly on women, and it forms in the cells of the breast. It is rarely in men, but it can also happen. The symptoms include bloody discharge from the nipple, changes in the shape or texture of the nipple or breast, or lumps appear with some kind of pain. We also have prostate cancer. In the prostate cancer, in the procedure, the seminal fluid that nourishes the transport system. Some of the symptoms that are included with this is difficulty in urination, and sometimes they can have no symptoms at all. This is mostly common in men, and it's rarely common in women. Now we have the basal cell cancer. It is very common. It appears as a white waxy lump or a brown scaly patch or sun-exposed areas such as the face and the neck. It can be treated or cured by the electrosurgery, and it's found in the skin. Now we have melanoma. It's a type of skin cancer. Radiation therapy and targeted therapy can be a way to treat it. The symptoms of melanoma is changes in an existing mole when the pigment producing cells that give color to the skin become cancerous. Now we have colon cancer. Colon cancer, it begins in the large intestine. It is in the rectum or in the digestive tracts in the lower end. Some of the symptoms of this is bowel habits, changes in stool consistency, blood in the stool, and abdominal discomfort. Some of the treatments can be radiation therapy or chemotherapy. Now we have lung cancer. The lung cancer begins on the lungs. It is mostly on people who smoke, but also secondhand smoke and exposure to certain toxins can be a way to get lung cancer. So it's very important when you see somebody smoking not to be near them, because if it affects them, it also affects you. Family history can have an impact also on the lung cancer, and surgery can cut out cancer tissue, and chemotherapy can be a way to treat it. Now we have leukemia. Leukemia is a rare form of cancer. It's a cancer of blood-forming tissues, including bone marrow. Slowly growing types of leukemia don't have symptoms, but rapidly growing leukemia causes symptoms like fatigue, weight loss, frequent infections, easy bleeding, and bruising. Leukemia is common in adults, but sadly is also common on children. Chemotherapy is a major form of treatment for leukemia. And now we have lymphoma. Lymphoma is also a rare type of cancer. It's a body disease fighting network. It has lymph nodes, spleens, thymus gland, and bone marrow. Symptoms is enlarged lymph nodes and fatigue, and also weight loss. Chemotherapy, radiation therapy, and bone marrow transplant can be a way to treat it. How is cancer treated? Well, like I said, chemotherapy, surgery with chemotherapy, radiation therapy, immunotherapy, targeted therapy, or hormone therapy are many of the ways that cancer can be treated. Depending on what type of cancer that you have or how advanced the cancer is the type of treatment a person will get to get treated or cured for cancer. Now, we can prevent cancer, and some of those can be by not using tobacco, protecting skin from the sun, eat a healthy diet, get immunized. Physical activity is also important. Know your family medical history, and get regular cancer screenings. That was my topic about cancer. I hope you guys like it, and I would be reading any feedback I get. Thank you.